Okay. Hello, my name is Yahira. My special topic presentation is about mental health. So why mental health? I chose the topic of mental health because I am passionate about dismantling the stigma around mental health in communities that I think that are continuously not given enough resources because of health disparities. I am interested in learning more as a Mexican American woman about how I can help my community and other less represented communities. I want to use the opportunities I have to help others just like me, and especially women and children who are one of the most vulnerable. The findings I found were that all the articles that I read were about mental health wellness, new ways to improve mental health, resources, and awareness. I noticed that I chose research that heavily impacts BIPOC communities and women and children. For week 2, I chose an article titled I Am a Strong Independent Black Woman, Strong Black Woman Schema in Mental Health in College Age Black Women. SWS and the correlation. This article was about SBWS and the correlations to both psychological distress and self-reported suicidal behaviors. The study concluded that SWS is indeed associated with suicidal behaviors and the fact that it is weighed by psychological distress. It created an understanding and, most importantly, identified the sources of health disparities affecting Black women. For week 3, I chose Yo No Estoy Loca, a behavioral health telenovela style entertainment education video, increasing mental health literacy among Latinas. The article focuses on the lack of knowledge and negative attitudes towards mental health and the link to low utilization of services among Latinx people. Um, so it concluded that educational interventions can increase knowledge and reduce stigma and shift attitudes about mental health. There is a need for more research and interventions that cater to underrepresented groups. For week 4, I chose WHO, World Mental Health Surveys, International College Student Project, in the prevalence and discrimination of mental health disorders. So basically, students demanded more mental health services on campus as there is a rising rates of mental disorders among students. The research concluded that we must create a space for dialogue and the importance of the need for mental health services in higher education. For week 5, I chose mental health care for Latinos, mental health services for Latino adolescents with psychiatric disorders. This was conducted and specifically in San Diego County, and the results demonstrated that Latinx adolescents were drastically underserved compared to their white counterparts. For week 6, Latina mothers' mental health, an examination of the relations in parenting and mental resources. Latinas' mental health is impacted by motherhood in relation to the parental self-efficacy, parenting stress, and overall maternal mental health. Their mental health needs are ignored. High levels of parental stress are related to higher risk of maternal mental health in comparison to self-efficacy. Week 7 is about coping with COVID-19 stress, the role media consumption, emotion, and problem-focused coping. So basically, media consumption, maybe due to isolation from COVID-19, plays a significant role with coping mechanisms and regulates basic emotions. For week 8, I chose an article titled School Response to Self-Injury, Concerns of Mental Health, Staff and Parents. The article found helpful ways to better support, was about finding helpful ways to better support children who struggle with non-suicidal self-injury. Researchers conducted interviews with 19 school mental health staff and 10 parents of adolescents with a history of NSSI, and basically concluded that there's just so much more that support that parents and teachers need in order to support their kids. For week 9, I chose Unseen Wounds, the contribution of psychological maltreatment to child and adolescent mental health risk outcomes. And this was about the effects of psychological mistreatment that children and adolescents face and how that can impact their mental health. And the overall conclusion was that there's importance of advocating and discussing psychological maltreatment, as it is often not seen as important compared to other forms of maltreatment. So yeah, these are my sources, and this was my presentation. Thank you so much. Uh, and yeah, thank you again, and I hope everybody has an amazing summer. Once again, thank you.